Today on the show, there's something very important that you want to hear about. We are ready to talk to you about it. All you have to do is stay on this dial. It's Healthy Living on Equate 9.7 FM.
Equate 89.7 FM. The station with the difference.
All right, back on radio right about now. So for the next 13-14 minutes, we'll be talking some top tips about your health, about my health as well. I mean, I want to be healthy as well. I'm sure Dr. Christopher wants to be healthy as well. Top of the morning to you, Dr. Grace.
Good morning, everybody.
And it's good to have you back on air. You're looking fresh. Like you took just a week off and you're looking all this fresh. Oh, come on. What did you do differently?
I don't know how we struggle on this one.
All right. But hope you've had a fantastic week, though.
I did. It went smoothly.
Okay, good. That's good to know. So, what health concern are we talking about today?
So today we're going to dive into knee arthritis, knee pain. But this is really following up on what we have discussed before.
Right.
And so before, the last few times we have come in and we have discussed our erectile dysfunction.
Right.
And we mentioned, it's a blood flow issue. But it all starts with our lifestyle. And so what we have discussed in the past is we have discussed diet, but we also have discussed exercise and proper sleep.
True.
Well, this is going back to deal with exercise. What really stop people from moving around as they should is arthritis. And but it doesn't start out as a full-blown arthritis is where you feel pain every day. It's usually start out at maybe a little ankle pain that over time, because of the way we change how we walk, it causes knee pain or back pain. So essentially what happens is that usually you might bump yourself, maybe accidentally fall, slip, and you injure one joint. And then that causes you to start to limp, to compensate. And so by using the compensating mechanism, it tends to lead to wear and tear. And unfortunately, the most common one is our knee, because it's carrying a majority of the weight.
But doctor, some people would say arthritis is an ailment or discomfort that only happens to old people when you're getting older. We've always said it. As you use your body degenerates. Of course, some tissues get regenerated. But it's been said that it's when you're getting older that you experience arthritis. But now you're saying it can happen even if you bump your knee or you bump your leg. Are you saying it can happen to anybody, actually?
It could happen to anyone. The arthritis, you have different kinds of arthritis.
Oh, tell us about them then.
And so the main one that everybody is more familiar with, we call it osteoarthritis, which is wear and tear arthritis. The cartilage wears down as we age. And so that's the more common kind. Obviously, we have a more systemic one that affects the whole body. That's called rheumatoid arthritis.
Right.
And those are similar, but those are not actually very common. Usually, it's really the wear and tear arthritis. And you have some old people. Maybe I don't like to use the word old.
What do you want to use?
So you're gonna have two different persons.
Right.
One is 70 and one is 50. And the 50-year-old is struggling to move around, and the 70-year-old is up and moving around as free as.
So it's not about the numbers, it's not about the age.
Not really the age. It's what happened and what intervention was done. So suppose that 70-year-old maybe twisted the ankle. It was late in the night, couldn't see where they were stepped down the stairs, accidentally twist the ankle, and they did the necessary remedies to treat the pain of the ankle before it becomes a long-term issue.
Right.
Because the issue is, if it's just short-term, a few days to a week, then we don't change our posture and how we move around. But if it's a chronic issue that is a few weeks to a month, then we start to change how we walk.
Right.
And this change over time tends to cause disequilibrium and that tends to affect one joint more than the other.
Okay.
And so now you don't have the necessary pressures equally.
So there's no balance.
There's no balance.
All right. I mean, it's interesting to note. Now, let's streamline it again to knee pain, as you said, as you called it earlier. When you're experiencing it, is it something you can just use some form of first aid, or you put a ice bag over it, or some people just get the balm? There are some very hot balms in Nigeria that people just get. You just rub those hot balms over it. Does that work?
Yeah. I mean, you could work those. Essentially, it should heal up within 2-3 weeks, right? So definitely, you could start out with that process first. But then the idea is, what after those doesn't work? And so this is where we step in with our treatments.
Okay, so step in now. Tell me about that.
So just as you mentioned, the first thing is you rest, cold pack, you elevate the ligament, elevate that joint. That's the first line.
That's
And
hot water massage.
that's fair. That you could mix based on how we are responding.
Okay.
I don't like to say, the textbook is you use ice. It causes a vasoconstriction, allows less inflammation in the joint.
Okay.
So, the ice.
You're using medical terms now.
Okay, let me run away from that. So, that's it. But you could also use heat helps blood flow to the ear, which helps with the healing process.
That's
too.
hot water now.
Hot.
All right.
Yeah. So whichever one, you just have to gauge and see how your body is responding to it.
Fantastic. That's one.
Yes. And so then, obviously afterwards people go to tablet medication, ibuprofen, naproxen, some people paracetamol. But if this pain is going on for over 4-6 weeks, then you really have to be careful, because now you might use different medicines and create other problems. So where we come in is where we once again introduce this term regenerative medicine, where we are trying to use your own body healing mechanism to heal you. So say if this issue is going on over 6 weeks, then you say, this is a little bit long, and it shouldn't be getting worse. The trend is, if it's getting better day by day or week by week, then okay, you'll probably recover fully and don't need to see a doctor. But if it's getting worse, a month come by and it's worse than before, then you should be checking out, because all these home remedies aren't being sufficient.
Right, true. So what's the therapy like from your own clinic? What's the therapy like for those who have severe knee pains, severe knee arthritis, who've they've been experiencing these pains for 3, 4, 5, 6 weeks? That's a lot of to deal with pain. So what therapy do you
6
do?
weeks, if they're going on months to years, we have the therapy is we do variation based on what the person has. We introduce shockwave is becoming very popular in the last few years. You shoot a pulsatile air wave that stimulates the strengthening of the tendons. And so these are non-invasive treatments.
And what is a non-invasive treatment now? You want to still further break that down? You don't have to puncture the patient.
I don't have to do any needles as yet.
Because some people don't like injections.
I know. But sometimes it's the quickest way to get into the spot.
I agree with you. So this you just send shock waves to that region.
Yeah.
And what's the response like?
Well, it stimulates. It stimulates healing. I'm trying to stay away from medical terminology.
No, you can say it.
Stimulates cell reproduction. Okay. So essentially, the strengthening of the ligaments or the strengthening of the tissues in that area.
And you have patients who've tried this on and it's worked for them. They've recovered.
Definitely.
Oh, that's fantastic.
It's actually so before you give medicines like ibuprofen, and if persons have this chronically or very long for over 6 months, then they might end up with peptic ulcer or something else, right?
Right.
So now you're trying to find other ways that has less side effect to produce results. And so these are one of the ways that, it's there, I think, getting popular around 5 5-6 years. They do it a lot with the professional athletes, especially in Premier League in England and stuff, because what you're trying to do, you're trying to avoid downtimes.
Right.
Where the athletes, remember, these athletes are making so much money a week. You don't want them sitting around for 6 weeks.
So you don't want to get any case of injury or knee pain. So you send the shockwave.
Yeah, so this is what they do. Exactly. It's, you know, this is like a 10-15 minutes twice a week. And it gets, you know, these things started a lot with these young athletes. And then afterwards it go up because they have the money to kind of do the experiment, because they're trying to, you know, you're in the Premier League, you know, every week counts.
Yeah, right.
So you're trying to get them back as quick as possible.
I mean, I agree with you. See, Liverpool button off yesterday. Those players now will probably be fatigued. I'm sure maybe they'll get that shockwave therapy in the course of this week before their next games next weekend.
Yeah, well, all right, suppose you lose Salah. How long do you want to lose him for?
I know, right?
If you don't do any treatment, maybe it takes 6 weeks to come back. But if you do treatment, maybe you can get him back in 2-3 weeks.
Now, Dr. Christopher, I'm bothered. Like every other thing, you said it. If you're using too much of ibuprofen, you put pressure on the liver, the kidney, you are Peltic ulcer. Now, does this have any is a repercussion now or any side effects now?
That's the beauty with it, because we're enhancing your own healing. So now we cut down the side effects. So we don't have to worry about all these organic, you have kidney issue, which is long-term issue. Liver recover, but still it's an issue. So that's the beauty with these treatment. One is shockwave. The next we do is platelet rich, where we spin your own blood, take the healing factor and re-inject it in the location to re-heal.
I think Dr. Osama mentioned something like that last week. There's something similar for erectile dysfunction as well.
There you go. So it's all along the same line of enhancing your body healing abilities.
I mean, it's been profound. Thank you for sharing this insight with us, Dr. Christopher. A lot of people are listening right now, and they want to get up close and personal. They want to, come to you and have these conversations with you and explain to them, like, doctor, this is where I'm having the problem. I don't want you to talk to me over the phone. I want to come see you. How can they get to talk to you?
So we're at 106 Ogunnusi Road.
Okay.
It's opposite road safety in Ogudu-Isheri.
Right.
Phone number is 916-395-5392. And phone number is 812-057-5581. So,
doctor, you're supposed to add +234 or 0 to that, but you get it. You get it down. So for those who just want to reach out to Dr. Christopher right here, 0916-395-532, 0812-057-5581. And are you online website for those who want to visit the website as well?
Yes, it's W Prime Medical. So WPRIMEMEDICAL.com.
Okay, wprimemedical.com, of course, and that's Dr. Christopher from Washington Prime Medical, right? WashingtonPrimeMedical.com. You can also visit them at 106 Ogunnusi Road, of course, on your way to Beja, right there, just opposite the FRC office. So then we talk about knee pain. We've identified that it's not everything you have to swallow medicine, swallow tablets. There are therapies that work for you, non-invasive, doctor, you call them, non-invasive therapies that work for you, and they're long-lasting, I want to believe.
Exactly, and that's the beauty of it.
Like, how long does it last for? One therapy, how long does it last for?
One therapy, so for many people, so it's, we come back to the age range. If you're younger, healthier tissue, that's it. You'll be treated well and no problem. If you're on the older side, this has been going on a long time, then you're going to get months to years of it.
But the advisories, when they come to, for consultancy, you advise them on what works best for them and recovery process as well.
Usually we do an x-ray and then we tell you from there. Usually that's where we figure it out.
All right. Thank you for joining me on the conversation on healthy living on the Quiz 9.7 FM this Saturday morning. This time next week again, we'll be back to talk about something even more interesting regarding your health. And I believe you'll be here with me, Doctor.
I will.
All right, that's Dr. Christopher, of course, from Washington Prime Medical Hospital right there. Join us again next week on this show. I'm Joshua Mara. This is 9.7 FM. The best of content continues only if you stay.
Good content. Exciting radio.